Patty, we know especially women can be affected by hormonal changes during their chemotherapy, and in some patients like breast cancer, we're actually giving medications that affect the hormone levels. Can you speak a little bit more about that?
It's definitely, hormone changes is definitely an issue that can certainly can affect our patients, especially our female patients. Changes within having increased hot flashes, night sweats, and even some mood swings are not unusual to see and really need to be reported so that we can help manage these. Menstrual cycles can be actually interrupted, or they become sporadic. Any changes in major ways with increased flow or absence of menstrual cycles really need to be to let your health team know that so that they can help you deal with that.
And when you speak about menstrual cycles being interrupted, they can sometimes, of course, stop completely, especially if you're near your own natural menopause or depending on the chemotherapy drugs you're getting. Could you speak a little bit about infertility and chemotherapy?
Absolutely. In the case of infertility, especially in a younger patient, that would be a topic that definitely needs to be discussed with your healthcare provider, especially with your doctor early on in your therapy. If it's an issue that may cause complete possibility of inability to have children at a later time, it would be a topic that would need to be discussed early. And that would be something that may allow us to be innovative in terms of preventing any kind of long-term problems along those lines. During chemotherapy, contraception is very important. Certainly do not want to get pregnant during your chemotherapy. It could certainly be problematic in a lot of different ways. So you do need to make sure that you are following good contraceptive measures during chemotherapy, just to prevent any kind of issues along those lines.
How long should someone wait after receiving chemotherapy before having sexual intercourse?
Approximately 48 hours. That certainly doesn't eliminate being able to be close to your partner, being able to touch, kiss, sleeping in the same bed. That is not a problem. But sexual intercourse would be something that you would want to probably avoid at least for 48 hours. Also, if your blood counts are low, at some point your nurse or your healthcare provider may ask you to be conscious and eliminate or avoid that. If your white count is low or your platelets are low, that may be something that they would have to also include.
And so hormonal changes, as you began to mention at the beginning of our discussion, can also affect pain with intercourse, and women should definitely report that because we do have some medications that can help with that.
Absolutely, and it's not a topic that's sometimes easy to discuss, but it's something that we can readily help with, so be sure and be upfront with your nurses or your physician and let them know. Also for men, fatigue, changes as far as narcotics and pain medications can also change your desire for certain activities, so being aware that there's a cause for some of these is helpful emotionally for a lot of people. So just share your concerns, share what's going on so that we can help or reassure you or your partner during this time.